Hello, my name is Jennifer. I'll be talking and educating about the subdural hematoma that happens in the brain. I will be going over a little bit of the anatomy and start from there. So, in the brain, we have cerebrospinal fluid, which is very important for our brain. It protects the central nervous system and it is formed in the ventricles and then circulates through the ventricles and into a subarachnoid space, which is between the arachnoid and the pia mater, before it is absorbed into the lymph circulation. It has its flow system and what does the cerebrospinal fluid do? It supplies water, amino acids, vitamins, proteins, and specific ions to the extracellular fluid and removes the waste, the metabolites from the brain. And so here are the ventricles that the CSF surrounds all the ventricles. There are 4 ventricles that also just provides protection to the brain by absorbing the impact when the head is struck. And so it has more than that. It does more than that, but it works together with the spinal fluid, cerebral spinal fluid, to protect our brain. And then we have our 3 layers of meninges, which is the dura mater, the subarachnoid space is here, but the arachnoid layer and the pia mater. And those are also important to describe about the subdural hematomas. So subdural hematoma, often abbreviated SDH, is a type of bleeding that occurs between the dura mater and the skull, which is the outer layer covering the brain, and the arachnoid mater underneath. This space isn't meant to contain blood. They often occur after trauma and when tiny veins are torn. Blood seeps out, filling the subdural space and puts pressure on the brain. The severity depends on the amount and speed of bleeding. Typically, subdural hematomas bleed slowly, and it can continue from days to months. And so that's a subdural hematoma. So before I talk about the signs and the symptoms, I wanted to go a little bit more into how this happens. A subdural hematoma, again, the most common is trauma such as a fall, motor vehicle accident, or direct blow to the head. However, not all cases require major trauma. Older adults are especially at risk because age-related brain shrinkage stretches bridging the veins, making them more vulnerable. Even a mild bump can trigger bleeding. Anticoagulant medications and clotting disorders also increase the risk. In infants and children, abusive head trauma such as shaken baby syndrome is a typical cause, and chronic alcoholism and some medical procedures may contribute in certain cases. Symptoms and signs, or signs and symptoms, can include a headache. Depending on the rate of the bleeding, an acute subdural hematoma often causes sudden confusion, drowsiness, headaches, weakness, and loss of consciousness. Chronic subdural hematomas may present as slow changes in cognition, mood, memory, and balance, and can be mistaken for stroke, dementia, or psychiatric illnesses if missed. Prognosis can be variable. It may need surgical treatment to remove the blood and relieve the brain pressure, but not every brain returns to its original function, mobility, and cognition. So here's the list of signs and symptoms. So here's another picture of a subdural hematoma. Overall, what can an occupational therapy assist with a patient that has a subdural hematoma? I would say task-specific training, environmental adaptation, cognitive rehab, fatigue, and routine management, as they can have deficits with dressing, bathing, toileting due to their difficulties with transfers, impulsivity, balance deficits, awareness deficits, loss of coordination, reduced attention, and decreased hand manipulation or function. And we just want to decrease their risk of falling for sure. But we would also educate their family and caregivers. And yeah, so this is subdural hematomas. Sometimes can cause lifelong consequences. Occupational therapy helps clients rebuild their lost skills, adapt environment and their routines. Through a blend of skilled assessment, intervention, and support, OT practitioners empower clients and their families to navigate their recovery process and live life to its fullest potential after their brain injury. Thank you.